Let's talk to Stephen Dorrell, former Health Secretary. My first reaction when I saw this, by the way, Stephen, very good morning to you, was that,
good morning, Mike.
you know, welcome to the real world, Wes. You know, it's all very well talking about what you're going to do when you get in charge. When you get in charge, you find out, actually, we're so desperate just to hold it all together that you might as well forget any targets and just kind of carry on limping through.
One of the aspects of the real world, Mike, is you have to make some choices. And so over the last week, we've had Prime Minister saying the key thing is waiting lists.
Yeah.
Wes Streeting on Sunday saying the key thing is more GPs.
Yeah.
Wes Streeting this morning saying the key thing is urgent and emergency care. Now, all three of those are important, and you can add social care, incidentally, because without social care, none of that will work. But you do have to make choices. When everything is a priority, nothing is a priority.
Exactly. And once again, here we are. I mean, you could have predicted it, as I could have predicted it for the best part of the last 25 years. We're on the brink of another winter NHS crisis because we haven't got enough beds, we haven't got enough ambulances, we haven't got enough doctors, we haven't got enough patients who can get into places where they want to go. The waiting lists are getting longer. We've got more and more people accessing the service. You know, I mean, it happens every single year at the same time. I don't know why anybody's ever surprised.
Well, yes, it's true, isn't it? The winter happens every year. That is true. What's also true is that if you want to deliver service to those who rely on the health and care system effectively at the time that they need it, as I was just saying, you do have to decide what your priorities are. Now, I agree with, it's almost true by definition, isn't it? That if somebody needs urgent or emergency care, they're a priority. That's why accident and emergency departments exist, to ensure that those who need urgent and emergency care can get access to hospital when they need it and can receive the care they need. But if that's going to work, if A&E departments and ambulance services are going to work, then other parts of the system have to work too, so that people don't find they can't see a GP or they can't get to social care or the care isn't available and they have an unnecessary fall, all of which has the effect of creating avoidable demand on A&E departments, which then creates a crisis in the hospital. It's when the rest of the system doesn't work that the hospitals come under unsustainable pressure.
Exactly. And I don't know of any part of the system really that works particularly well at the moment. What I don't understand is why, once winter has passed, somebody doesn't get to grips with it all and go, well, we want to try and avoid that next winter, so what can we do? But they don't seem to ever do that. They don't ever seem to spend, you know, the sort of spring and summer and autumn trying to work out how to avoid a winter crisis.
Well, I think if you went round, you'd actually find there are plenty of meetings held where they try to create a plan to deal with that. So it's not true to say nobody thinks about it. That's not right.
Well, let me put it another way, then. What they're not doing is achieving anything.
No, well, what is right, as I was going to go on to say, is that year after year, the political class thinks that it defends the NHS by ensuring that the hospital budgets are safe, and in order to do that, taking money away from local authorities, away from social care, away from GPs. The community pharmacies are in crisis at the moment because cash has been taken out of pharmacies. So when pharmacies close, where do people go? They go into overloaded GPs. When they can't get an appointment with the GP, they go to A&E departments. That's why the system doesn't work.
Yeah, and that's the problem. And why can't they fix it, though? Even in some small part. I mean, at the moment, for example, some GPs are still on a work to rule because they're not happy about the settlement they've got from the government. You know, at the moment, there are still people in hospital who are off sick, who have been off sick for a long time, therefore leaving all sorts of gaps that have to be filled by agency staff who cost an absolute fortune. You know, it's an endemic problem that continues to sort of rehash itself every couple of weeks.
Well, it's back to the first point we were discussing, that if you're health secretary, you have to make some choices. And the problem that we've got at the moment, I think, is that there are just hopelessly confusing messages coming out of the government. It's waiting lists on Thursday, it's GPs on Sunday, and it's A&E departments on Tuesday. Now, you can't blame NHS managers if that degree of confusion is coming from the leadership.
Well, except I can blame NHS management because NHS management has been mismanaged for as long as I can remember.
Well, no, but okay, but there are good managers and there are less good managers in all organisations, including the NHS. But if the person responsible, at the end of the day, it's taxpayers pay for the NHS and pay ultimately through local government for social care. So those who are responsible owe it to the taxpayer to set out a set of priorities and follow them through. And that's why I say it isn't good enough to talk about waiting lists on Thursday, GPs on Sunday, and A&E departments on Tuesday.
Yeah. No, I get what you're saying, but I mean, whatever it is that they need to do, they need to bloody well get on with it, because we've been having these conversations for as long as I can remember, and nothing seems to ever improve. It just keeps getting worse. So surely somebody has to pull the plug on it and maybe put it out of its misery and start again.
Well, it's quite as simple as that, Mike, is it? Because at 10 o'clock this morning, people are going to present themselves at A&E departments, so they're going to need care. So you've got to do it real time. But what you do have to do is recognise that until you can relieve the pressure on the urgent and emergency departments, the pressure will go on building.
Yeah.
So
I get all that. It's very frustrating, not only for you, as I'm sure it is for me, but also for the people who are trying to access the bleeding hospitals. Anyway, we'll talk soon. Stephen, thank you very much indeed.